Hi, Dr. Shiva Prasad. I'm consultant physician at GVK Health Hub. See, right now what we are seeing in this summer season is most of like heat stroke, dehydration cases, skin infections, flu infections. Heat stroke cases mostly we see in the children, elderly people who are traveling a lot, who are spending most of the time in the day. Uh, so the risk who are like they're wearing tight clothes, vigorous excess activity in the sunlight. So what these people need to take precautions is like they need to wear light colored cotton clothes, adequate hydration regularly, and also the dietary habits are these days like people are taking more of processed foods, unhealthy dietary habits, not getting adequate sleep, not getting adequate exercises. So what is all required to maintain a healthy lifestyle? The first thing pillar is the nutrition. So diet rich in fruits, vegetables, whole grains, lean proteins is encouraged. Number two is physical activity. A regular physical activity of 32 minutes to 1 hour a day on an average of 150 minutes in a week is always encouraged. Third one is sleep. 7 to 9 hours of quality sleep is recommended. Stress management. Techniques like meditation, yoga, spending time with family is good to maintain to tackle stress. Hydration. I would recommend 3 to 4 liters of water every day, not just in summer but other months also, because the whole body, majority of the system, 60% of this human body is made up of water. So when the hydration is less, the blood gets thickened, the blood supply is lessened to the vital organs. Important organs are affected. So next is for the mental well-being. You can seek a professional help whenever required to tackle this whatever you call this depression, anxiety, when you're not able to handle on your own. We have to avoid unhealthy habits like alcohol, decrease in caffeine intake, drug abuse. All these things we have to avoid. Last but not the least is regular health checkups. Get regularly checked up by the doctor, get the required tests done, and be fit. Yeah, basically true weakness is a medical disorder. Like it can be a myasthenia gravis, it can be a periodic paralysis like Duchenne muscular dystrophy. That is a true weakness. But fatigability is a sense where you're feeling like dull, you're feeling it can be a medical cause, it can be a psychological cause or a physical cause. That's a fatigability. So lack of interest in doing regular things is a like depressive state. So you're getting recurrent episodes of all this like apprehensionness, tremulousness, and this palpitation are all features of this generalized anxiety disorder. So what are the common physiological causes for this fatigability is we can see in like people who are having less physical activity, who are like having less rest, inadequate sleep, improper diet are all more prone to get this physiological weakness, we can say, or fatigability. So what are the common medical causes for this weakness? Is iron deficiency anemias, heart failure, COPD, that's lung issues, chronic kidney diseases, nutrition deficiencies. These are like we need to catch them, we need to treat them, and psychiatric illnesses are also common causes for the weaknesses like general depression disorder, generalized anxiety disorder, personality disorder. So weakness and fatigability, these are like very vague term. We need to see where the person fits in and what needs to be done.